take your seats. There are still one or two seats spare, so thank you very much. Good morning and welcome to the first ever Healthwatch Norfolk Live. Just before we start, there's probably a little bit of housekeeping. First of all, if you do hear a fire alarm, we'd ask that you follow me because I shall be first out of the door, I promise. Through the main doors, and the forum staff will direct you to the fire assembly area outside the building. And the toilets, for those of you who need to know, are just outside. So you go out to the main door on the left and you'll find them there. We also have a quiet area for anyone who wants one. Just ask one of the team and we can find you a quiet area where you can watch the meeting online. As you may be aware, we've struggled to find a BSL interpreter to interpret live today. We will be putting a fully BSL interpreted version of this meeting online as quickly as we can. And we will also have a subtitled version online by the end of the week. In fact, technology permitting, hopefully by the end of today. Our journey to this event has been a little bit unusual. Today started life as our AGM, which gave us the opportunity to give you an update on our work for the last 12 months and look ahead at what is to come. Unfortunately, it seems a bit strange. When I saw on my car today, it was 6 degrees as I drove here. So we hardly can remember the extremely hot temperatures, but those very hot temperatures that we experienced earlier in the year meant that we had to postpone the live event with an in-person audience and transfer to an online-only event with just a few hours' notice. That formal business part of the AGM is available to watch online by searching for Healthwatch Norfolk on YouTube. We did still want to have the opportunity to talk more about health and social care, particularly with the major structural changes which began in the summer with the start of the integrated care system, bringing the operation of health and social care much closer together. So we've come up with the idea of Healthwatch Norfolk Live. And later this morning, leaders from both sectors will be here taking questions around the changes and what they will mean to you, the patients, and the communities in Norfolk. Also this morning, we'd hoped to welcome GP and author Dr. Richard Pyle, but he'd regretfully had to cancel earlier this week because of staffing pressures in his practice, a common theme, I'm afraid. We're delighted instead to be welcoming Mike and Shannon from Thriving Workplaces, who are going to talk about resilience in the workplace. It's also fantastic that we are full for today's event with every seat allocated. We're heartened that so many of you are keen to get involved, to ask questions, discover more about health and social care, and engage with us as we continue our work as the voice of patients and a critical friend to those who work in health and social care. I should just pause at this moment and say I've been in post as chair of Healthwatch Norfolk for just over a year now, and the reason that I particularly wanted this job was because I had huge respect for the two senior execs who are at the top of the tree at Healthwatch Norfolk, which is Alex and Judith. And I'm absolutely delighted to say that every single person that I've found that works in Healthwatch Norfolk and is connected with Healthwatch Norfolk are doing an absolutely outstanding job of listening to the patient and sharing the patient experience with our health and social care providers. It is a huge privilege for me and a great pleasure to be part of this organisation, and I hope that you'll hear more about what the organisation does during today. And, of course, listen to the answers to the questions that we've been posed by people on the run-up to this event. So with that, I'm now going to hand over to Alex, Healthwatch Norfolk's Chief Exec, who's going to take us through the past year's work and give you an update of 12 months' work in around 5 minutes. Good luck, Alex.
Thank you very much, Patrick. I'm very much welcoming everyone here this morning, and a special welcome to Louise Ansari, who is our National Director for Healthwatch England. So thank you for coming as well, Louise. It would be remiss of me not to start this marathon run-through without thanking board members for their ongoing support. They helped to provide me with the most outstanding team. Without the team, I would not be able to stand in front of you feeling immensely proud of all the work that they undertake, ensuring that the views of patients, carers and residents are heard. I would also like to take this opportunity to thank Norfolk County Council in particular the public health team, for their ongoing support. They provide us with money in order to undertake our work. Through the team's dedication and hard work, our brand awareness has increased considerably over the last 12 months. This has been borne out by research that has been undertaken by Healthwatch England on a national basis. We've spoken to local community groups, refugees and asylum seekers, sex workers, young and old people alike, with a wide range of conditions and problems. So on to some very quick statistics for you. We've had 2,033 reviews of health and social care services. We've had 833 general inquiries. We've produced 16 reports providing information, research and recommendations for both commissioners and providers of services. Work we have done includes collating and communicating COVID-19 information, looking at the issue of domestic violence amongst older people on behalf of the Safeguarding Adults Board, collating the issues around access to NHS dental care and keeping up the pressure on decision makers for something to be done, an ongoing saga, reporting to both the Health Overview and Scrutiny Committee, as well as collaborating with our national colleagues. Collaboration with the Queen Elizabeth Hospital in King's Lynn to help them improve communication, with a focus on a range of communities, including some great work with the College of West Anglia students. Our thanks to the commitment of all staff involved from the Queen Elizabeth, who helped ensure that this project was a huge success. Communication for cancer patients was another focus, with people telling us they would like to choose the format of their appointments. Letters have now been amended for patients, and a prompt card created to help patients think of questions ahead of their appointments. Digital access came under the spotlight. Patients told us they wanted a clear and concise document telling them about the digital help available, clearer language on doctors' websites, and more video consultations for those who want them. We chatted to people helped by the Norwich Vulnerable Adult Service. Commissioners are now currently considering rolling out this services to other areas of Norfolk following the positive feedback that we received. We've unearthed issues around getting interpreters and translation in healthcare if English is not someone's first language. We will be going back to health organisations in the next year to find out what progress is being made with that. Sharing information is very much a two-way process and is a key component of a successful Healthwatch. Primary care colleagues have been subjected to some very bad press recently, sometimes justified, but frequently unwarranted. We worked with the general practice in Norwich to explain how GP practices were working during and after the pandemic to help patients understand how things work and the wealth of experience and help available to them. Our face-to-face engagement work continues, and our team go out to both clinical and non-clinical settings to discover people's health and social care experiences. I'd just like to remind you all about when Healthwatch started in 2013. There were two of us. There was a woman called Christine MacDonald, who's in the audience, and myself, and we sat in an office in Heatherset thinking, what are we going to do? That said, at that point, we received a grant of £658,000 from the County Council, which is money that came down through the Department of Health, but with additional funding that the county very generously gave us. Our current funding is in the region of £338,000, some 50% less 10 years on. In 2013, we had a team of 2. We now have a team of 17. The grant monies, for which we are very grateful, pay about 1/3 of the work we undertake on behalf of the public. Other monies are raised through commissioned work. Healthwatch is a credible organisation, working tirelessly to try and effect change. As we move forward into the next 12 months, the work will increase. The advent of the Integrated Care Board and associated partnerships provides massive opportunities for radical change in service provision. A taste of some of the projects that we will be undertaking include understanding people's awareness of patient participation groups, what they can bring to the table, an engagement report focusing on GP access, work on use of digital tools to enhance service provision, mental health transformation, looking at cardiovascular disease with public health, working with One Norwich practices to understand the benefits of the walk-in centre, and working with adult social care looking at standards and quality of provision in care homes and dom care settings. And finally, a review of a specialist care in Norfolk following the damning report in relation to the tragic deaths at Causton Park. To conclude, I would like to assure you that all the team will continue to work to ensure that the patient voice remains at the centre of everything we do. And we will strive to ensure that we are able to meet the demands, the ever-increasing demands that are required. Enough from me, but before our guest speakers, here's a chance to look back at our work over the last 12 months, condensed into a couple of minutes. Thank you very much for listening.
Relationships and communication, the two issues at the heart of everything we do. 12 months ago, we were just coming out of COVID-19 restrictions, which impacted on all of us. It meant tricky paths to get better care and support, and issues around access. Now we're at the start of a new, more joined-up health and care system, bringing services closer together and the opportunities this brings. So let's look back at the past 12 months and what we've achieved. Firstly, the numbers. We published 2,033 reviews and received 823 inquiries from people needing advice. We published 16 reports about improvements you'd like to see, and our team of 13 staff and 16 volunteers helped us carry out our work. So how have we made a difference? We collated and communicated COVID-19 information, examined the issues of domestic violence among older people, and collated the difficulties people were facing getting NHS dental care. Those who are deaf and hard of hearing were asked how care could be made more accessible when going to their GP surgery. A deaf and hearing loss charter was created to help staff understand the needs of patients, as well as ensuring technology was available to help book appointments and know when they're called in to see their GP. Cancer patients told us they wanted a greater choice over the format of their hospital appointments and sometimes, understandably, found them stressful. Changes have now been made to patient letters and a prompt card created for those patients to think ahead about what questions they want to ask hospital staff. There was a recommendation to expand the vulnerable adults service across Norfolk. Currently operating in Norwich, it gives targeted health and wellbeing support to people in the city with no fixed abode, who all praised the help they were given. The Queen Elizabeth Hospital in King's Lynn asked us to look at how they communicate with patients. We spoke to a range of people through surveys, focus groups and targeted engagement with students at the College of West Anglia, and recommended the hospital uses a number of different methods and channels to keep both patients and the community up to date. And talking of consultation, we also looked into digital access to doctors, including more information about the digital options and freshening up the language and labelling on the Footfall GP surgery websites. As the way GP surgeries help and assess patients evolved, we tried to explain those differences and went into a Norwich surgery to follow the patient journey and give an insight into what happens when you get in touch with your practice. Our volunteer team also remained very busy looking at documents, attending virtual meetings and helping our engagement team. Talking of which, once restrictions lifted, we were back out face-to-face across Norfolk, gathering your health and social care experiences to look at trends, concerns and good practice and feed that back to health and social care leaders. Looking ahead, lots more work is on the horizon. Our focus on accessibility continues with the Your Care Your Way campaign, ensuring patients get information in the way that is right for them. We'll find out what people believe the barriers to getting care from their GP are, and also discover how patients and communities are finding their voice through patient participation groups. So lots more projects and studies coming up. That's just a snapshot, as well as a very busy continuing programme of engagement. So we're getting ready for another exciting, challenging and rewarding 12 months where our relationships and communication remain key.